My patient was a 79-year-old female with complaint of right ear pressure for 3 weeks, and she reports that my ear feels plugged up. Her past medical history is hyperlipidemia, hypertension, GERD, hypothyroidism, neuropathy, and eustachian tube disorder in both ears. There's no pertinent surgical history. She is a non-smoker, she's widowed, she lives alone at home and has 3 adult children living near her. She reports that she has allergies to neosporin and to polysporin. Review of systems, she complains of a hearing deficit to her right ear and some drainage that was noted to begin about 3 weeks ago. She has tried putting warm water in her ear. She has used warm and cold compresses, and she has used nasal decongestants and intranasal topical steroid spray. She has not introduced any Q-tips or other objects into the ear, but has attempted to clean her ear canal with wet washcloths. About 1 week ago, she had a sudden pain to her ear and she felt dizzy that day, both complaints which resolved within 2 days. She has been alternating with Tylenol and ibuprofen since then and is no longer experiencing pain, just the pressure. On physical exam, her blood pressure was 179/84. The other vital signs were normal, and she is obese with a BMI of 35.6. Her right ear canal is erythemic with dark brown hardened ceramin, partially obstructing full view of the tympanic membrane. The visible portion of the tympanic membrane had a perforation noted. The external ear on the right was tender to palpation, and there was no periauricular node swelling, no erythema or tenderness at the mastoid process. Her left ear appears normal with a pearly gray intact tympanic membrane. The differential diagnoses included chronic otitis externa, H60.61, also right ear ceramin impaction, H61.21, and malignant otitis externa, which is H60.20. That can occur in diabetic patients, although she is not diabetic. The final diagnosis was H66.011, acute suppurative otitis media with spontaneous rupture of eardrum, right ear. She was given prescriptions for Augmentin, 875/125, BID for 10 days, and Ciprodex eardrops to instill 4 drops to the right ear every 12 hours for 7 days. She does have a follow-up appointment with ENT in 2 days, and she had requested this 2 weeks ago, and then she's going to follow up with me again in 2 weeks.